Yeah.
How far would you go to
Sorry.
You need to make a little effort, like hold it.
How far would you go to have a baby? Would you like to have a laboratory one? Nowadays you can have one. How is this possible? By in vitro fertilization. How is this method made? By in a lab, they join the eggs from a mother and sperm from the father, and they do insemination. This is this is something that many infertile couples do, but despite the benefits that this procedure might show, there are also some consequences. So today we're going to put in the table the negative aspects and the positive aspects, so we know if it is good, if this procedure is good, or if it's not. And this debate, Daniela Madla will say that will try to convince us why is in vitro fertilization not a good procedure, while Ricardo tells us the benefits of it. Let's hear Ricardo's perception of in vitro fertilization.
Hi everyone. Well, I want to begin talking you about how this started. In vitro fertilization was made in the first time in 1978. It was Louis Brown, an Englishman who was first born by this procedure. And since then to 2012, 35 million babies have born from in vitro fertilization, showing that this procedure has had an important impact into our society, and it has gained more success nowadays. The possibility of having a successful procedure is of 30%, and it's a way to let infertility couples to have babies, so they can feel the happiness of being in a family.
Thanks, Ricardo. Now let's hear Daniela's point of view.
Thank you, Manuel. Well, as you said before, I'm going to give a little intro about what is in vitro fertilization. Well, they take several eggs from the mother and they have a sample of sperms of the father. So in laboratory, they make the insemination. There is the combination. It spends 5 days in probation to see if everything is going well. And after this period, all the embryos are one of the embryos are implanted in the mother's uterus. And that is when it starts the process of pregnancy. Well, in vitro fertilization, it's good because it helps sterile couples to have families. But it's nice, I'm not against that, to have family, but don't forget that it's a very polemic topic and that inspires a strong debate of ethics in this practice. Also, less than the 5% of sterile couples tries in vitro fertilization, and the main causes are because of the damage of fallopian tubes of the woman, or also by the bad quality of the sperms of the man. Well, my position is against this procedure. Why? Well, in my opinion, I think that in vitro fertilization is a technique that is inherently immoral. They treat embryos as things instead of human beings. There are couples when they choose in vitro fertilization, they create to create embryos to build their families. The unused embryos are frozen for the future attempts of pregnancy. So, for example, there's a couple who wants to have a family. They want to have 2 kids, but you have 6 embryos by using this procedure of in vitro fertilization. What are you going to do about the other 4? They're going to stay frozen. So this is something that most couples are unprepared for what to do with the remaining embryos once their family is complete. Right now, over 500 500,000 embryos currently remain frozen in only American clinics. This is only America. So this is something that it's a really big number, and I think, in my opinion, it's something really controversial. Also, let's see, first we have to understand what is an embryo. Well, unlike an egg or a sperm cell, an embryo is a complete pre-born human being with a full set of chromosomes and a DNA, just like you and me. Also, science tells us that life begins when a sperm and an egg unite. So, from that point, the embryo only needs nutrients and a safe place to, well, develop. And you are prohibiting that, and you are not letting them because you keep them frozen. So, if you gave a chance, if you gave 9 months that embryo, it will be a baby. If you give him 21 years, it will be a guy like you and me sitting right here taking this debate. So I'm just saying, this is not moral and not ethical.
Thank you, Daniela. Now we would like to hear from you. What are some risks of the in vitro fertilization?
Well, here are two sides of the coin. I would like to say that because, well, it implies the embryo and the mother. Right now, well, the embryo have several consequences, like, well, frozen embryo accumulation. Even there is an increasing number of these frozen embryos. Also, there are eugenic risks, and also they are, well, exposed to utility of experiments of the unused embryos for investigation matters. So I think, well, they don't have the right to, well, embryos have the rights like the person. So you are not letting them. You are using them like animals experimentation. So I think it's not right. Also, the other side is the mother. Well, one of the risks is the multiple pregnancy. Also, well, by having this multiple pregnancy, there are a lot of probability to have premature babies or also to have low weight. So it's really delicate. Also, well, it implies mental and physical health of women. But because it increases the blood pressure, also it can, well, have an uterine bleeding. Also, by having like an in vitro fertilization, it can imply a cesarean, so it's, well, it can be dangerous. Also, it's a very expensive treatment. Not everyone can, well, afford that treatment. Thank you.
Okay, now that we heard the risk that you said, why do you think people take these risks?
I think that they take risks because they want to have family and they don't have the elements to be one. Maybe they can adopt a child, but it's always a different feeling of having a baby from your genes, from your genetic material, than looking for a child that was born from another person. Also about what you said, I think that there are many couples that would like to donate their embryos to other couples that can afford the procedure, so those embryos can be used, and so they are not stored like many years in the clinics. So there are many ways to get, I don't like how this sounds, but to use those embryos. Also, there are many couples that would like to let science to use those embryos so that this procedure can become better, so the risks can be lesser, so that the risks are not so big, and maybe we can reach a point at which we don't need so many embryos, and just having one we can develop or have a baby. But if we don't make research, we wouldn't be able to get to that point. So maybe we have to decide what would be the best way if we want to help those families to have their own child. We maybe will have to make some kind of sacrifice in our way, and maybe there is a debate about when really life starts. There are different areas, not only about just when the egg and the sperm are joined, because at that moment this embryo doesn't have the same capabilities that we have, and there are different areas about maybe life starts just after the embryo is inside the mom, and after it has stayed there for 3 months, so it has developed some of the most basic functions of a human. So I don't think it's that easy to say that the embryo is exactly as we are right now. And also there are some embryos that don't have all the genetic information in them, and that's why some of the in vitro fertilization doesn't work, because when they put the embryo inside the mom, there are some chromosomes missing, so that's why it fails, the procedure fails. So maybe it should be better if we try to find when really life starts.
Thank you, Ricardo. Daniela, I would like to ask you, what can you tell mothers that can't have babies and are desperate to have babies? What can you tell them? What is an advice you could give them?
Okay, well, it must be really sad for women that are not able to have babies. I understand their desperation. If I were in her or in their place, I will also do everything in my hands to have my own babies. But let's not forget that, well, by doing this process affects other lives. And you are not only you, but you are implicating others, the embryo's lives. And, well, answering to, well, it's okay. This process affects the unborn. And you cannot hide the bad side. Okay, you want to have a family, that's cool. But do you know what happens to the frozen embryos? If I were a mother and I had a baby by using this procedure, in vitro fertilization, it would be like a question to me, what if I had chosen another embryo? And what will it feels to have, like, I will look at that girl, little Lucy or little Jack, I don't know, and I will say, wow, I choose him, but what about the others? I don't know, it's something like I personally feel and I don't like it. And for example, you have to think about the whole package. And there are solutions. You can adopt babies. There are a lot of persons who cannot be able to sustain babies, so they give it to the adoption, and you can have a family that way. And you are not, risking the lives of the embryos. Also, those frozen embryos have the right to live, and you are prohibiting them. And as you said, that the embryo can be a human being after 3 months, or it's like a question of the scientists because you don't know when it's going to start to be a baby. Well, like I said before, if you give him or give her time, it will be. You are stopping that process. But it's the same. Again, you can be a person even if you're in process or not. Also, in a personal opinion, in addition, also the selection of embryos involves a selective abortion of spare embryos, an eugenic practice that the church is shameful and totally reprehensible.
Ricardo, do you have anything to say?
Well, and what would be the difference between deciding which embryo to use and maybe using the next day pill? Because if you do that, you are stopping the process of the born of a baby, and it's not as the society doesn't see this as bad as maybe vitro fertilization, and maybe it would be something similar, because after a day the sperm and the egg have already mixed and become into an embryo. So why couldn't we see the in vitro fertilization process in a similar way to that kind of practice?
Well, here we are entering to a topic that is anti-conceptive field, so they have field. But again, you are looking at a thing. That embryo, you're looking at a thing and not a person. So you, after you take the day after the pill, I think. Okay, what's it? After day pill. Yeah, you don't know if you're pregnant or not. But of course, it can be abortive and it can be bad. But like I said before, it can be like entering into another topic.
Well, I really think that maybe we give in vitro fertilization some time. It can improve, so it can left in the past all these needs of using like 10 to 15 embryos to assure that the mom is going to have a baby. And nowadays scientists are trying to make some sure, so they take a look at the embryos to see if they are complete, because there are sometimes that the genetic information is not complete, so they can reduce the number of embryos that we have to use, and maybe if we improve this, the in vitro fertilization will not create too many embryos that are going to be waiting in a clinic. So I think it's a little bit difficult to decide, because if we don't let it to improve, we won't know if it's going to be a better procedure. So I think that we should let it have a chance to become a better procedure with time, and maybe not ban it totally.
Well, to finish this session, I would like to thank both Ricardo and Daniela for presenting their point of view and presenting us the negative aspects of in vitro fertilization and the positive things. Now what we saw that in vitro fertilization helps mothers that can have babies, that can permit mothers that can have babies the pleasure and happiness of being a mother. But it has meant a great advance in technology. But this procedure has also meant a big risk in the woman's life, because it also presents various problems. The most common problem is the ovarian hyperstimulation syndrome, and this is very common among mothers that do this process. Maybe in vitro fertilization is not a bad idea. It's a really good idea, but I don't think the technique that are used are the right ones. So we can conclude that it's something, maybe it's a good idea, but nowadays we are not prepared for this method. But maybe in a couple of years, in 10, I don't know, 15, the process will be we'll have the right technology to continue this process. But when the time comes, I would like to ask you, is having a family worth the risk? Thank you for